Welcome to part 2 of our series of videos introducing you to motivational interviewing. Within this video, we'll discuss how to elicit change talk. As a reminder, assessment of readiness to change is an essential foundation for motivational interviewing. In particular, we are identifying individuals who are in these earlier stages of readiness to change, in the pre-contemplation, contemplation, or desire stages, and we're supporting these individuals to help motivate them to move into the action and maintenance stages. The less ready the patient is to change, the more important it is to do motivational interviewing. When individuals are not interested in changing, we can use strategies to help them become interested in changing. And when they are feeling ambivalent, we want to help them tip the balance and understand how the pros outweigh the cons when it comes to change. Let's focus in a little more on this idea of ambivalence and how we can use it to our advantage when we are doing motivational interviewing. Although some may view ambivalence as a negative thing, we actually see it as a great starting point when we're doing motivational interviewing, and it's an important target for our efforts. The definition of ambivalence is the state of having mixed feelings or contradictory ideas about something or someone. Within a behavior change context, this is a state of mind in which a person has coexisting but conflicting feelings, thoughts, or actions about whether or not they want to change. It's this in-between where we don't know whether we should stay with the status quo or change. And ideally, we can work with this state of imbalance in hopes that we can help this individual move towards movement and change rather than staying in this stuck, ambivalent state or moving back to the status quo. One important part of overcoming ambivalence is recognizing change talk. This is preparatory language that signals a desire to move in the direction of behavior change. And change talk is a really important thing to identify when we're in a motivational interview because these are the patient's own arguments for change. This means we don't need to tell them why they should change, why they can change, the desires they may have for change. These are the statements that the patient is giving to us so we can understand why they think change may be possible or desirable. Change talk falls into 5 different categories. Statements related to a desire that express their wants or wishes. Statements related to abilities, the areas where the patient thinks that they can make change. Statements related to reasons why change might be a good thing to do. Statements related to need, the reasons why the patient may need to change, or statements that are outright commitments to change. Because recognizing and working with change talk is an important foundation for guiding your motivational interview, let's talk more about examples of each of these types of change talk. Statements that express desire to change often talk about what the patient wants or wishes. So for example, statements like, I do want to eat more vegetables. I really wish I could exercise more. I would really like to lose 10 pounds. Or it would be great to eat out less, all express some sort of desire for a change of behavior. Change talk that expresses ability can be a great jumping off point for identifying the strengths that patient has that may help them through their behavior change efforts. There are some vegetables that I like. I probably could walk instead of drive to work. I have been able to lose a few pounds in the past. And I am a pretty good cook when I have the time. All give us great information about the things that the patient thinks that they can do or could build off of to support their behavior change process. Change talk focused on reasons give us important motivating factors. These are the factors that the patient themselves think are good reasons for change. That means that we can emphasize those reasons and use them to instill intrinsic motivation. Examples include, I know vegetables are really good for me, which expresses a motivation around health and the healthfulness of one's diet. Or, exercise does make my back feel better, shows that the individual feels different and feels better when they exercise. Losing some weight would probably help me sleep better, shows that the patient sees a direct connection between weight loss and their quality of life. I would save a lot of money if I ate out less, shows that that individual sees that cooking more meals at home would have tangible benefits for their financial health. Some change talk expresses needs, showing that the patient understands that they need to make this change in some way or another. Some examples of need-related change talk are, I really need to grow up and stop eating like a picky child. I ought to find more ways to be active. I just recently put on this weight and I really need to figure out why. I really ought to find the time to cook at home more. Finally, change talk may be an explicit commitment to actually try to change. Some examples include, I am going to try one new vegetable this week. I'll try to walk to work this month. I am feeling like I'm ready to make some changes. I'll look up some meal plans when I get home. These are all great statements that indicate that the patient has come around and feels ready to move out of their ambivalent state. Many times as we go through motivational interviewing, change talk comes up naturally. As the patient works through their ambivalence, they may discuss reasons why they don't want to change, but these different reasons why they do want to change through these forms of change talk. However, sometimes change talk doesn't come up organically. And so if we're in a motivational interview and we're not hearing change talk, there are things that we can do to elicit it, to make sure that we're getting these statements out there and getting the patient to believe that change is a good thing, something that they desire, that they have the ability to do, that they have reasons to do and a need to do, and that they can commit to. And often what we see is that when we say something out loud, we feel more embedded to it. It becomes more real and more tangible to us. So eliciting change talk can be a great way to move someone closer to change because they start thinking through why they need to change, how it will benefit their life, and how they can make it happen. We have many tools that we can use for eliciting change talk, including the Readiness Ruler, imagining extremes, Elaboration, looking forward, and looking backward. Let's talk through each one of these tools and how you can use it in your practice. The Readiness Ruler is a tool that helps us learn about the patient's perceived strengths and barriers. There are different questions that you can use for the Readiness Ruler. We'll talk through two, but there are other ways that you can use this tool to get at the information that you want during a motivational interview. If you have the ability to use a visual tool, you can actually give the patient a scale that looks like the one on the slide, where they're ranking from 0, not at all, to extremely, 10, their answers to the questions, how important is this change to you? Or how confident are you that you can make this change? By asking the patient on a scale of 1 to 10 to rate how important this change is, or how confident they are that they can make this change, you get a great sense of where that patient is. Where are they in their readiness to change, and what strengths and barriers may be in place that you can either use or try to work around. After you ask the patient where they are on the Readiness Ruler, you can then further probe to learn more about why they are in that spot on the Readiness Ruler. For example, by asking them what would need to happen to get them from where they currently are on the scale, let's say they set a 5, to higher on the scale, a 7 or 8, you could ask what would need to happen to move you from a 5 to a 7 or 8. This question will allow you to explore their perceived barriers. If the patient responded, more time, I just don't have enough mental energy to focus on this right now, this gives you a very robust clue as to where you can go next. This individual feels that they don't have enough time to make health changes, so you definitely don't want to lead them towards solutions that may be time intensive or labor intensive, but rather see if there are solutions that would fit into the limited amount of time that they do have available, or that can replace some of the things that they're already doing, so it's a time neutral change. You can probe even further to pull out the patient's perceived strengths by asking a question like, why did you say 5 and not a 1 or a 2? The patient may say something like, I've lost weight before, so I think I can do it again. And this shows that they have some confidence, some self-efficacy that they can be successful at weight loss. You can work with this strength and emphasize that they have done this in the past and they have the skills to do this again. Do you remember how the effective physician used the Readiness Ruler? Go back and see if you can see her use of this tool. At one point, she said, if you did decide to quit, on a scale of 1 to 10, where 1 is not at all confident and you don't think you can do it, and 10 is certainly you could, where do you think you fall right now? And the patient responded, probably like a 5, kind of in the unsure area, like, I know I've done it before, so I know I can do it, but at the same time, it seems really hard and it's not the same situation. And the physician probed further to gain more information. So already in this little snippet, we see that the Readiness Ruler brought out some important strengths and areas of concern for the patient. She said she's a little ambivalent in terms of quitting smoking, but she has some confidence because she was successful in the past. She expresses her barriers by indicating that it feels a little overwhelming and she's in a different situation now. So these are all areas that the physician can explore more to help her pull on some of those skills that helped her in the past, as well as to understand how to make it feel less overwhelming and how to adapt her strategies to the situation she's in now. Another way we can elicit change talk is by prompting the patient to imagine extremes. This exercise can help the patient think through the consequences of not changing versus changing. So for example, we can ask the patient, what is the worst thing that could happen if you continue with this lifestyle? And have them explore and even visualize the ultimate health effects of the status quo. We could also ask, what would your life look like if you made all these changes? Taking some time to explore and visualize how life would improve if these behavior changes were made can help to strengthen motivation, as well as the feeling that this change will matter and will make a difference. You should always prompt the patient to elaborate as well, especially if they are giving brief responses. This encourages the patient to think through things and talk more, which helps you understand their situation and how you can help through motivational interviewing. So you can use statements like, tell me more about that. What about the last time that happened? Give me an example. What else? All of these are great supports for information exchange and show the patient that you want to learn more, you want to understand their situation and their problem, and you want to help. Similar to the imagining extremes exercise, prompting the patient to look forward and back helps them visualize their situation and needs for change in different ways. By prompting them to look forward, they can visualize the harms versus benefits of staying the same versus change. So you can ask questions like, what would you like your life to be like in 2 years? And how does what you're doing now make that difficult? What would it be like if you continue with the way things are now? Suppose things don't change. How do you think your life will look? All of these questions might help the patient think through some difficult ideas and realities that they've been avoiding thinking about or have been minimizing to help them stay the same. As a complementary tool, looking back helps the patient analyze their own behaviors and their abilities. By asking, when was the last time things were going well and you were exercising? What was it like for you? What do you think could have prevented this setback? As you step back and look at all this, what do you make of it? These questions all prompt the patient to reflect on their own behaviors and experiences and think about how they can learn from their successes and mistakes to improve in the future. Do you remember seeing these tools in the Effective Physician's motivational interview? At one point she says, what made you decide to quit when you're pregnant? How were you successful when you quit before? The client's response illustrated her perceptions of risk then versus now. We saw that her perceptions of risk to her baby were a really important motivator, and she just didn't feel like her smoking was affecting her baby as negatively now as it was back when she was pregnant. This was a really important tidbit that we didn't receive in the ineffective exchange because that physician didn't use the same tools to learn about the patient's perceptions and experiences. So to recap, change talk can be an important pivotal point within a motivational interview because it shows that an ambivalent patient is leaning towards change and thinking through what change might look like in their life. Change talk is an important way to highlight strengths and barriers that the clinician and patient can then work through together. If change talk doesn't come up organically, then you have a number of tools that you can use to elicit change talk. The Readiness Ruler, Imagining Extremes, Elaboration, Looking Forward, and Looking Backward are all effective ways to better understand your patient's situation and help them move towards change. Let's review some key takeaways. Although some may see ambivalence as a bad thing, We actually see it as a good thing in motivational interviewing because it's an important target for our counseling efforts. When we're working with an ambivalent patient, change talk indicates that the balance is beginning to tip towards change. So we want to recognize change talk when it's happening and then guide the interview accordingly so that we can glean the benefits from that change talk. If needed, we can also elicit change talk using a number of tools that help us to learn more about our patient and their needs for support.